it's safe, it's not safe, it might be safe. What's happening?
What is happening, Liz? I don't understand why this controversy keeps resurfacing. I understand that people want hope, people want an answer, but this is all kind of sparked because a massive viral video went out that the president retweeted, in which several physicians wearing white coats right in front of the Capitol building in Washington, D.C. to make it look really legitimate, were talking about how hydroxychloroquine is a cure and people were curing patients in their clinics. But they were also talking about how masks didn't work. And this is just a lot of misinformation. Neither the FDA, the NIH, or any major medical body says that hydroxychloroquine works. There's a reason why clinical trials were stopped. Yet this one video came out and people were saying, hey, it works on all my patients and it's a cure. And so this has just sparked a whole other round of questions and controversy where there shouldn't be. It doesn't work. We have no evidence of it. And the president should not have tweeted this video out.
So too long didn't read answer is it's not a solution. Not good.
It's not a solution.
Yeah.
It isn't. And it's actually misleading to tell the American people that there is a cure for coronavirus. It's just not true. We don't have one right now. And there is no actual study to back that. These are just people sharing their anecdotes, which, like the Washington Post said, sharing your anecdote is like sharing a Yelp review.
Very true. But as you talk about just people wanting anything they can cling to, any kind of optimism, then let's talk about what's the latest with a vaccine. What is the latest right now?
The latest is optimism. So we now have 6 vaccines in phase 3 clinical trials, which is great news. It's also really quick speed. Scientists are moving right now to get a vaccine out there. The latest one is the Moderna vaccine, which has been there's a collaboration with the NIH to get this vaccine out there. This is entering phase 3 trials right now in the United States. It's the first one to really start in the United States. They're going to be testing about 30,000 adults to look to see if 2 doses of the vaccine protect people better than placebo or no vaccine. And that's a really important step. That's the first step we have to making sure we have a working vaccine by the end of this year and hopefully for distribution to everyone middle next year, maybe. But good news.
Okay, middle of next year, maybe for distribution. That was my next question I wanted to ask you about because, we've been sort of hanging on to this hope of getting a vaccine. But then once we get this vaccine, who's going to be the first people to get it?
And I think that really depends on not only which vaccine actually becomes available first, but what the distribution looks like you kind of insinuated. So not everyone actually knows the answer to that. When we have a working vaccine, that could be by the end of the year. Some companies are saying they may have one by September, but that doesn't necessarily mean everyone can get one.
Right.
So likely what's going to happen is people who are higher risk or actually need the protection, such as frontline workers or people working in a hospital, may get it first. And then as the tiers go down, the general public will be able to get that. And I think that's a really big question that's going to have to be addressed in fall when we start to see results.
Right. And then obviously there's anti-vaxxers. There's so much more we're going to get into when that happens. But let's just get that vaccine.
Oh, we're already there.
Yeah, we are. True.
We're already there with anti-vaxxers, unfortunately.
Right. That is going to be a thing, or is a thing. But let's just go rapid fire now with some of our questions that we're getting from viewers. If COVID-19 is airborne, this is anywhere safe anymore? So if it's airborne, is anywhere safe?
Well, a lot of places are safe depending on how much ventilation you have. And obviously indoor is going to be less safe than outdoors. And you really want to think about how many people you're around and if there's any ventilation and how long you're in that space for. So the inside of a restaurant is obviously going to be different than if you're going in and out of a grocery store. So it just depends on the risk factors in that closed space that you're in. But take the right precautions and you'll be safe.
Okay, our next question is it safe to breathe in your own CO2 for long periods of time wearing a mask?
This is a myth that has to get debunked. So there is no proof at all that wearing a mask is going to elevate your CO2 levels to a dangerous degree. And the real world evidence are surgeons who are wearing masks for 12 hours a day when they're working shifts, and they've been doing this for decades. Or think about people in the construction industry or the people working in industries where they're wearing these masks all day long. So there is absolutely no risk to elevated CO2 or the humidity or getting any type of infection or anything from wearing a mask. It's simply not true. You're totally safe and recommended to wear one.
Okay, our next question, can the virus live in your carpet?
I guess theoretically, it could live on your carpet for a small amount of time. We know it can survive on surfaces. That doesn't necessarily mean it's the most transmissible from those surfaces. But again, you, just like we talk about wiping down your surfaces, if you've been exposed, you want to make sure you're taking off your shoes, you're changing your clothes, you're doing your best you can to kind of limit spreading it around your house.
You know, I want to give a shout out to whoever asked that question, because we've been doing this for months now, Dr. Patel, and that's the first time I think I've heard that question. So
it's a good question. You have to think about how far you can transmit this thing in your own house.
Absolutely. Okay, so another question from our viewer is, should I wear a mask while driving by myself? And I think that is something I've heard anecdotally. A lot of people say, why do I keep seeing people drive around alone wearing a mask? So what's your advice?
Well, some people are wearing masks if they're quickly running from errand to errand. You know, I've seen a lot of the rideshare drivers are wearing masks, which I think is great, necessary practice. But if you're in your own space, even if you're outside and you're distanced from everyone else and you want to take a break and take your mask off, you're perfectly safe to do so. Just remember, you get it back on if you get around anyone else.
All right, we're getting so many questions today. I love it. If you have the antibodies, can you get it again? I know that that has been sort of something maybe we don't even fully know yet.
We don't fully know the answer to that yet. And that's kind of that's a testy one, because right now there's a lot of studies looking at how long the antibodies are going to last, with some people estimating the half-life, or when the antibody concentration is at 1/2, is about 3 months. People with weaker symptoms or asymptomatic are going to make less than those who are hospitalized. So time's going to tell. But we do know that over time, your immunity will kind of wane. And so that's why the vaccine is so important, is because it's going to be designed to give you that long-lasting protection, as opposed to the natural immunity you may get for a limited amount of time from actually getting coronavirus.
And when we're talking about antibody tests, do you recommend people go and get one? And then this person's asking, where do I get one?
Not everyone needs to get one. You know, it's really designed for people who had symptoms in the past and really thought they had coronavirus or had an exposure and didn't get tested. So one thing that I wouldn't want anyone to do is just go and get an antibody test for fun, out of curiosity, or get an antibody test when you should be getting a viral test. So an antibody test, again, is going to tell you that you've had a past infection. And if you're concerned about this, or you think you should get one, I would chat with your doctor just to make sure that you have the right information going into it and that it's actually right for you, because it's not recommended for everyone.
So this is sort of a broad question that we could do our whole show on, but give your kind of, big picture headline on it. Do you think it's safe to send our kids back to school in the fall?
Big picture headline is it absolutely depends on the school district, the community, transmission rate there, the age of your child, if your child has any other health risks. So the bottom line is regardless of what people hear in the national conversation, there is no one size fits all rule when it comes to reopening schools. It has to be done in a systematic way. And the CDC made a very bold statement about why they need to reopen. We all agree they need to reopen at some rate when it's safe. But just like that, every school district needs to have their own set of variables to really consider how to do it without spiking cases.
Mm-hmm. Right, and keeping our teachers safe and staff, of course, too.
Absolutely.
And, so something I want to ask you is, I think, whether it was last week, right, that California surpassed New York, became the state with the most coronavirus cases in the country. We do have the largest population, and so per capita, I know we don't have the most cases, but I think we're kind of using that to justify why things are maybe okay right now. What is most concerning to you with what we're seeing in California?
What's concerning to me is that we still have that test positivity rate of around 7.5%. It would be great to see that continuously going down. I know we have a state goal of lower than 8%, but it's also concerning that we're still seeing community transmission. People are getting tired right now, and the virus can literally spread from community to community in this massive state of ours. And when you have one county that's doing a great job and another county next to it where transmission is high, all it takes is one little outbreak to get that county kind of spiking up again, which is why a lot of people are looking at San Mateo County and saying every county around San Mateo County is on the watch list, and it's only a matter of time before San Mateo is as well. So what's concerning to me is that the virus is still here.
Right.
And it's still really ready to have an outbreak the minute we let our guard down. That's what the virus wants. So we cannot let that happen.
I mean, I was going to ask you about that. It is pretty remarkable that San Mateo sort of clung on for this long. Why is it? What are they doing right?
I'm going to assume that all the data reporting, just for argument's sake, I'm going to assume that all the data reporting is accurate, because I did hear echoes that some of it is delayed from July 23rd. And so Governor Newsom does think that San Mateo may wind up on the watch list, but let's just assume it's all accurate. I've also heard that they've been really strict about mask wearing. And there's images of people going to businesses and being very strict about wearing masks. And, the general public has been great when they're in their behavior about kind of preventing the risk. So that might be one factor. It also may be that people are physically distancing better. I'm not 100% sure. But again, their per capita rate is starting to cross that threshold that the rest of the counties on their watch list are. So it's only a matter of time, unfortunately, unless something drastic happens.
Right. I think we have about 30 seconds before we just got to head to break. So my question for you then, Dr. Patel, is a face mask better than a face shield? Does it really make a difference?
It does make a difference because the face mask, when worn properly, is going to provide a better seal. So a face shield is not ineffective, but you have to think about the fact that you can still get transmission all around your face shield. When in doubt, you can wear both of them because you're going to have added eye protection. You don't need to walking day to day, but a face mask is going to be more effective.
All right, Dr.
I wear them both. I wear them both when I'm in a high risk situation, just saying.
I think that makes sense. I mean, I would do. I have a friend who's about to fly, and she's like ready to mask up on several fronts. So
I flew, and I was like.
We see that picture. All right, stick with us. We're about to take a break. We'll keep chatting on Facebook. But up next, we're getting a first look at an ABC special airing tonight, American Catastrophe. How did we get here? I had an interesting conversation with ABC's Cecilia Vega, and she will share her insight with us coming up next. All right, Dr. Patel, we can keep talking. I'm told our Facebook Live got started a little bit late, so I want to circle back to hydroxychloroquine. And sort of your thoughts on that.
Well, it's not even my thoughts. It's the fact that when hydroxychloroquine was first touted at being able to treat or prevent coronavirus, there were studies run all over the world, and none of them showed conclusive evidence that it worked. This is why the FDA made a statement against it. This is why the NIH stopped clinical trials. Now, it is completely false for people to say, hey, hydroxychloroquine's been around for 60 years. It treats other diseases. It must treat this as well. That is just simply not true. That's like saying you can use Tylenol for anything you want because it works for reducing pain and a fever. Different drug, different application. It doesn't work that way. And also, when some of the doctors on this video that President Trump shared said, we treated all our patients in clinic with hydroxychloroquine, the majority of those patients were going to get better anyway with supportive care because they didn't have severe cases. You could have given them peanut butter or said sleep on cardboard, and that may have, they would have gotten better anyway. That's just an example of correlation not equaling causation, if you know what I mean. So it's not fair to say that. I even heard one doctor saying that hydroxychloroquine should be available over the counter. Absolutely not true. That would even be dangerous.
Right. Yeah, absolutely. Absolutely. Sorry, I just got accused. We have maybe 45 seconds. Judy here is saying, I think that there should be another shelter in place. We opened everything up way too soon. That is something that we've heard this week from some experts. What do you think?
Judy, there's over 150 medical experts in this country who absolutely agree with you. And we may need to actually consider a brief couple-week shutdown just to get everything back to where it's manageable. Because right now it's running out of control.
Yeah, absolutely. Dr. Patel, it is always such a joy to have you on our show. Thank you so much.
Liz, thank you.
We'll see you soon. All right. 10 seconds away, guys, if you're watching on Facebook or YouTube. Stand by.
6, 5, 4, 3, 2, 1.
Welcome back. ABC is airing a special tonight called American Catastrophe. How did we get here? I spoke with ABC News senior White House correspondent Cecilia Vega about it, and here's a first look at the special and my conversation. If you're watching on Facebook Live, feel free to leave a comment about how you think we got here.
They say close to 1.5 million people have gathered here tonight.
I'm a pretty easy, low-key person, so I was at home with my wife and a couple of friends.
We welcome another new year together.
It was the first time in a long time that I had an opportunity to get my whole family back together. And we're going to spend New Year's Eve and the day after together.
3, 2, 1.
We were cooking a dinner and celebrating the New Year's and then just went to bed.
I did get a phone call from my colleagues at CDC that there was a mysterious new pneumonia.
Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan.
This interesting new respiratory infection, we didn't know what it was.
It was obviously concerning.
The Chinese at the time were saying that it was just the jumping of species from the wet market.
And this wet market was thought to be the source.
It was zing-bang back and forth. It was very clear. I was on the phone with Bob a lot. Both of us agreed that this looks, smells, and almost certainly is a new coronavirus. And the question is that what are we going to do about it?
Joining me now, our Bay Area girl turned ABC News senior White House correspondent, my good friend Cecilia Vega. Cecilia, it's so good to see you.
Hi, it's so good to see you and talk to everybody at home. Hey, guys.
All right, so a lot has happened in the past few years since we covered the 2016 election together. A lot's happened in the past 6 months. I'm really looking forward to this special tonight because, as you know, here in California, we now have the most cases of any state in the country. And I think a lot of us are wondering, how did we get here? So what did you find?
Yeah, so Liz, this is a 3-month investigation that the team here, the investigative team did, and we really just pull the curtain back because I think this is 6 months in. The question that everyone is asking, how is it possible that we got to this point, and is it going to get any better going forward? And I got to tell you, the results of this investigation surprised me. I mean, you mentioned it. I'm at the White House. I'm on the front lines of this every day, and what we found was pretty shocking. There was no shortage. There were no shortage of alarm bells that were sounded and raised, and we go all the way back initially to China. So we go into Wuhan at the very beginning of this pandemic, and we look at the cases that were happening there, and frankly, the lack of transparency that we were getting as an international community from the Chinese government. And our healthcare workers here in this country and investigators were not allowed to go into China to see for themselves what was happening there. So that was red flag number one. But then you fast forward to what was happening here domestically, and you'll remember at the time, at the very beginning of this, back in February, President Trump was saying publicly, you don't have to worry about this. It's all just going to disappear like a miracle. We go behind the scenes, though, to what was happening inside the administration, and we look at decisions that were made, like the cuts to the pandemic planning office at the National Security Council, and you can see a direct correlation, that thread, the result of that cut to where we are today. And then we also pull back the curtain on these so-called Red Dawn emails, and this was a chain of emails, multiple emails written by healthcare professionals inside the administration, out of the administration, national security experts who just sounded the alarm over and over again about what they were seeing in China and how this could end up being basically a once-in-a-generation pandemic, a global pandemic unlike any we'd seen before. And then you ask yourself, well, how did all this happen? Well, you got to remember, back in January, this was an administration that was dealing with an impeachment. So a pandemic wasn't on the front burner at the time, and here we are now 6 months later.
Yeah, and Cecilia, you know, something I find so striking is just also how political this pandemic has become. It's political to wear a mask now. So from all the experts who you all spoke to, how much of where we are now is attributed to some of the rhetoric from the White House versus other factors, China, for instance, as you mentioned?
Yeah, this has been a problem from day one, this kind of nasty fight in terms of where we are right now between politics and science. And I think you and I both know this from covering the story. It's politics that has won out often. We're in an election year, there's no doubt about it. But the health experts that we talked to, and we spoke to so many of them, we sit down with Dr. Fauci for this hour. We sit down with Dr. Robert Redfield, the head of the CDC, the FDA commissioner, the assistant secretary of health. The list goes on and on. People who are still inside the administration and people who are outside the administration. And, you know, for some of them, I think there is a sense of frustration when it comes to the politics that's happening. The science for them is very clear. When it comes to wearing a mask, masks saves lives. It sort of seems crazy that we have to keep saying that over and over, but we do, because these cases, as you know, is what's happening in California, are skyrocketing and spiking once again. And health experts like Fauci say we're only halfway through this. It's just going to get worse before it gets better.
Right, and another issue is testing. Still a big problem here in the Bay Area. There are issues with getting tests, long delays in getting results, and yet the messaging from the COVID-19 task force is that this isn't a problem. Why is there this discrepancy?
Well, there is a problem. I mean, they're sort of black and white when it comes to this. The messaging can be one thing, but the reality on the ground, as you guys know, you've been covering this, is another. This is not a biased statement to say that it is unacceptable that a test should take 2 weeks to get the results back. That just refutes the entire purpose of having testing. For me, one of the big surprises, I think, in this special tonight is to hear the director of the CDC concede, admit that mistakes were made, that balls were dropped early early on as it relates to testing in this country. You'll remember back when the CDC was mandating that its tests were the first round ones to be used, and those tests didn't even work. That was a huge problem in California. Well, in this special, you're going to hear him address that, and I think some of the things he says might surprise you.
Thanks to Cecilia for that interview, and you can watch American Catastrophe. How did we get here tonight at 9 right here on ABC7? Should be pretty fascinating. All right, we're going to take a break on air, and when we come back, the COVID-19 impact on affordable housing and what we do now. Stick with us.
Any commercial break?
All right, hello, do you hear me, Daniel?
Yep, I can hear you.
Hi, thank you so much. This is Liz. Thanks for joining us today. Looking forward to our chat.
Yeah, looking forward to chatting with you as well.
Thanks so much. Okay, I think everyone's on Facebook. Let's see what people are saying. Thanks everyone for sharing your ideas. I know this is sort of a controversial topic in many ways, but we appreciate hearing from everyone. Someone saying, how are we worse than New York here in Cali, but not on lockdown again? Makes no sense. You know, Andy, I've been wondering that too, and I actually dug into the numbers last week and did a comparison on New York versus California. And I mentioned this earlier, but you know, California has double the population as New York. So in that sense, sort of, I guess, reassuring on our part is that even though we have more cases than New York, we have double the size and double the population. So per capita, it's not like we're at that point like New York City was back in the early days of this pandemic. And so, you know, at this point, our hospitals are not overwhelmed to that same extent. And so we're not at that point yet where it's a crisis of that magnitude. But of course, this is still a crisis, and there are experts that are saying we really should crack down. So thanks for that question. All right, we're about a few seconds away, maybe 20 seconds away, so I'm just gonna take a second. We'll be back on air soon, guys.
We are starting back in 10, 9, 8, 7, 6, 5 seconds, 4, 3.
All right, the impact of the pandemic is far and wide, and part of our commitment to build a better Bay Area is to look at housing. So joining me now to talk about this is Daniel Simons, principal at David Baker Architects and a member of the San Francisco Housing Action Coalition. Daniel, thank you for joining us.
Thank you for having me.
So, you know, the pandemic has shown us many things, and one of them is the unbelievable need that there is for more affordable housing and spaces for people to live comfortably.
Yeah, I mean, I think that, you know, there has been some impact on the housing market. You know, some people moving away from the Bay Area or moving out of the Bay Area, but in general, you know, we see that there's still a huge housing shortage, and that housing is still, you know, unaffordable to most people. So the affordable housing crisis has not really waned very much at all.
Right, right. And, you know, could you talk a little about some of the challenges that you are going to face now in terms of building new housing through this pandemic?
Well, yeah, I mean, one of the things that has been good is that even as the first shelter-in-place orders came in, you know, the production of affordable housing was specifically called out as an essential service, so it was allowed to continue even as other things were supposed to shut down. But, you know, they couldn't continue on the same pace or with the same efficiency as they were before, just because most of the rest of the economy was shut down. Plus, there was a lot of, you know, effort that the contractors had to put into making sure their workers were safe and practicing social distancing and all those things. So we've definitely seen that the buildings that were under construction have been slowed down, and there have been cost impacts for all those additional efforts, which make the affordable housing, you know, even slower to get to the market and also more expensive to build, which are, you know, two things that we don't need.
Absolutely not, right? And you kind of touched on this already, but have you seen any changes in the housing market since the start of the pandemic, or what kind of changes have you seen?
Yeah, I mean, there's definitely been, you know, I think that there have been you know, especially in San Francisco, you know, there's a little bit more vacancy. There has been a little bit of softening in rents, I think for the average person, you know, the rents are still unaffordable, and certainly for the people who are being served by the affordable housing that we're building, it's not like the cost of housing has come down where you know, somebody who is, you know, making an average salary can afford because the housing in the Bay Area is just so expensive to start with. And I mean, I know we don't have a crystal ball. We don't know what's going to happen when the pandemic is over, but in my estimation, we'll still have a housing shortage, and housing is still going to be way too expensive. And so, so we just have to keep trying to keep building it during this crisis, so that at the end of it, we're not in a worse situation than we were when it started.
What about, you know, we're seeing a lot of people work remotely, which might lead to some more commercial space. What do you think about maybe turning some of those commercial spaces into housing?
Yeah, I think that's definitely a possibility. I mean, we have, we've actually already been approached by a couple of our clients, you know, a local housing authority that was looking at purchasing some commercial buildings that were on the market to see if it was possible to turn them into, you know, temporary housing for the homeless, or maybe even permanent supportive housing for the homeless. So I definitely think there will be opportunities out there. I hope that there's, you know, funding available for the nonprofits and the government agencies that can do this work to take advantage of that, you know, because it definitely will require some capital to make it work.
Absolutely. Daniel Simons, thank you so much for taking the time and talking with us today. We really appreciate it.
Thank you for having me.
Thanks. All right, we're going to take a break on air, but the conversation continues on our live streams, including Facebook Live right now.
In commercial break.
Okay. All right, let's see what y'all are saying. I feel like whenever we have hydroxychloroquine, our comments go a little wild, which is good. I'm already getting some comments on my Facebook page as well, showing me some studies. So let's see what y'all are saying. Yeah, I know Eric over here saying mainly civil argument. I agree, it is. I know, lots of questions. Yeah, well, you know, I know. Trying to look at these comments, but getting pretty intense.
1 minute.
Yeah. Well, you know what? Things we can all rally behind, I think, are taking a little bit of time off for ourselves. And I was just telling Dr. Patel earlier that I went on a socially distanced road trip up to Mendocino, went camping, and found it to be very safe, very pleasant. People took it very seriously up in Mendocino. Everybody was wearing their masks, which was nice to see. And it was just a great way to kind of decompress and unplug. And so I highly recommend it. So I hope all of you watching right now can all, I know we all get very heated and passionate, and I hope that we can all take a little bit of time just to disconnect and decompress and focus on what's important to all of us. All right, stand by. We're about to come back on. All right, thank you all so much for joining us on this interactive show, Getting Answers. We'll be here every day at 3 on air and on our live stream, answering your questions. Facebook Live, YouTube Live, abc7news.com, and our news app. World News Tonight is next. We'll see you at 4. All right, Facebook, thank you so much. Appreciate it, guys. Have a good one.